we already heard about how important information transfer is when it comes to, for example, teaching medical doctors that these apps exist and actually can do some good. And that takes us actually into the next topic already, educating the digital rehabilitation professional of the future. So I would like to welcome Kaisa Lälla from JAMK, University of Applied Sciences in Finland, Patricia Renner, junior researcher here in St. Pölten, and Inmaculada Riquelme Agulló from the University of the Balearic Islands, telling us about education of digital rehabilitation. Thank you.
Okay, good afternoon for everyone here in this beautiful auditorium, and also for you online. So, competence for the new era of user-driven digital rehabilitation, DIRENE in short, is the ERASMUS-funded 2-year project, which is now in its midway. And we are working in that project together with our 4 partners from different kind of universities all around Europe. So we from JAMK, University of Applied Science from Finland, Jyväskylä, are leading this project, and we have a multidisciplinary partners from University of Health Science, Bochum, Germany, University of West Attica, Athens, Greece, University of Balearic Island from Mallorca, Spain, and of course this beautiful University of Applied Science, St. Pölten, here from Austria. And together with this team, our aim is to enhance and increase the resilience of rehabilitation system by improving and developing of digital rehabilitation competencies among the teachers, students and working life professionals. So our context is to enhance the teaching and training opportunities relating these digital rehabilitation solutions. And here are our specific objectives. So improving, developing knowledge about the digital rehabilitation, but also increasing learning opportunities. And probably the term digital rehabilitation is not familiar for all of you because it's not very well defined, at least it wasn't earlier. But together with our team, we have defined this term, and this is probably still on progress, but at the current, what we are meaning about this digital rehabilitation is the use of digital technologies as part of the rehabilitation process. And the digital technology can be used by professionals or by the end user or clients. And the digital rehabilitation technologies are also used in different phases during the rehabilitation process, so in every different phase. So, and the aim of this digital rehabilitation is to optimize functioning and reduce disability, as well as empowering the clients. In this project, in the beginning of this project, we identified megatrends and future visions, what is coming on the field of digital rehabilitation. And we found out that VR, AR, robotics, but also different kind of AI-based solutions are identified as a megatrends, but also there are a lot of expectations how these digital solutions can modify the rehabilitation and rehabilitation processes. But something what was very highly emphasizes in our results, which we received from literature and also focus groups, was that there are going to be needed some kind of integrative platforms where we can combine the data from different kind of digital rehabilitation solutions. So now I hand over this to Inma, please.
Thank you. Where are the... Okay. At the same time that we were trying to define the megatrends in digital rehabilitation, okay. We were interested in knowing the factors affecting the use of digital rehabilitation. Why are we using them or not? And we made a research in the literature, and we made focus groups with professional teachers, students, to identify facilitators and barriers. I would like to highlight that one of the barriers we found were that professionals and students had identified the necessity of having training on digital competencies, which is the main goal of the DIRENE project. Which competencies we have and which competencies are needed? We made also some more discussion groups, some questionnaires, and we had the good surprise that we knew a lot about how to implement digital tools, but still we were lacking or had the necessity to improve some specific competencies, mostly about our knowledge about policies, legislation, ethical issues, and more specific ones like developing content, how to solve technical problems, and how to communicate through these digital tools, which can be a bit different than in a face-to-face environment. And how are we going to do it? How are we going to work these competencies? This is something that Patricia will tell us.
So, thank you very much, Imna. Yeah, my colleague has just presented a few competences which are necessary for digital rehabilitation. I will now talk about selected findings on which type of content is needed in order to teach these competences and how they can be taught. First of all, the first thing is adapting the healthcare process to different digital settings. This requires content on telemedical development, on the creation of digital content, knowledge in the application of technology to acquire technical expertise for digital rehabilitation. This includes obtaining the necessary data, the preliminary information for the patients, the medical presentation and findings of the patient, as well as the amnesis scheme documentation and so on. It is also important to focus on adapted interaction between service provider and service user. This includes designing different digital settings, methodological preparation, rules in the setting, advantages, limits, disadvantages, and knowledge of professional-client-professional relationship. In other words, knowledge of how to create a trusting, secure, professional-patient relationship for digital rehabilitation. In addition, content on professional development, the professional identity is important. This includes teaching interdisciplinarity, user experience and users' perspectives, reflective skills, interpersonal training, communication and empathy, stress management, ethical issues and ethical awareness. Furthermore, communication skills and ethical awareness are necessary for the digital rehabilitation process. When it comes to teaching, we should therefore focus particularly on conversation techniques, such as talking in simple language, digital counseling techniques, and digital and non-verbal communication. The goal is to ensure that service users receive support and pedagogical guidance. And now the question arises, how should we teach this? 3 categories have emerged in our research in this regard. Firstly, via theory, using current scientific literature and specific literature on digital rehabilitation processes in conjunction with assignments on the literature and practical examples. It is also important to address concerns and take them seriously. Secondly, it is important to teach digital rehabilitation in a practical way, to practice it and to carry it out. This requires the provision and use of technology in the classroom. The third aspect is directly related to the practical exercises. We should teach digital rehabilitation using digital technology. This means that we need digitized, user-friendly and aesthetically pleasing learning materials. We should also refer to social media and use videos or mobile devices in our teaching. But how should learning with mobile aspects should be designed? To do this, we should ensure usability and learner-centered content. This means ensuring accessibility for people with different diagnoses and of different age groups. In order to reach as many groups of service users as possible, it is important for them to feel confident. Learning with mobile aspects should be easy to understand, in other words, not too complicated, and should therefore use easy language combined with interactive tools and different information. To this end, the learning materials should be available in various formats such as written texts, in videos, via social media, podcasts, and so on. These different learning materials are necessary to enable a smooth transition from offline to online. Now we have told you a lot about the empirical research, but in addition, a written survey was conducted with teachers from the partner organization on the question of which tools they currently use in their teaching to impart this content in a mobile way using mobile devices. We found that while certain tools are already in use, there is still potential for using big data and AI in teaching in future, for example, chatbot. Based on all the above-mentioned surveys and the resulting findings, we have developed a handbook for teachers, which my colleague Kaisa, our project leader, will present you in more detail now.
Thank you, Patricia. So, as Patricia mentions, we are now gathering all of those data, what we have received so far, to the handbook for teachers in order to improve teaching methods and ways of teaching digital rehabilitation solutions. And you can find our results from our web pages, which you can see the link there. And also the handbook will be published in that web page completely when it's finished during this month. And next autumn we will be piloting a study module which we will be designing based on these earlier results, and spring 2023 that study module will be published openly as a 2 ECT credit MOOC. So please go and see more information from our web pages and follow us in Twitter or Facebook. Thank you.
Thank you very much for your talk. Well, I think we have time for one or two questions. We're a little bit over time, but it's not too bad. So are there urgent questions right now? Okay, then maybe a question from me. Could you say one or two sentences about the target groups? Because there are many different stakeholders in this field, professionals from all different directions. So whom exactly do you see as your target audience here? Health professionals, doctors prescribing stuff?
Yeah, great question. So the target group is the rehabilitation teachers, students, and working life professionals. And when we're talking about the rehabilitation, we mean it very widely. So all the professionals and teachers from physiotherapy to social work, and who also health promotion. So there may be also some doctors and medical professionals or nurses, but basically the target group is the rehabilitation staff, teachers and students, so those therapeutics and all the stuff associated for that.